We are back. And when we talk about substance use disorders, we're talking about all of the substances. And many of us probably have family members or know friends who have issues with alcohol. My father was a functioning alcoholic. He went to work every day and he came home drunk every day. My sister she had her challenges as well. And I personally had her admitted 3 times for help, but now she is 14 years sober. So we know the resources are out there to help, and we know that we need to continue to do everything that we can to address the issues that we are facing in our communities, especially when we're knowing in the midst of this pandemic, alcohol use is growing. So what I would like to do now is to introduce 2 of our panelists that are going to come forward. Dr. Poland. Dr. Poland was trained in internal medicine at St. Joseph Mercy Hospital in Ann Arbor, Michigan, and is in addiction medicine at Boston Medical Center in Boston, Massachusetts. She has an interest in educating healthcare providers and providers in training, to improve care for patients with substance use disorders and alcohol use disorders. She is an assistant professor at Michigan State University. She is the past president of the Michigan Society of Addiction Medicine. She is the medical director of addiction medicine at Spectrum Health and collaborates with other providers in Spectrum Health's Great Moms program to treat pregnant women with substance use disorder. Also, we have State Representative Hammoud, and he's serving his 2nd term in the Michigan House of Representatives, emerging as a strong voice for civil rights and a leading mind for health policy. He represents the 15th House District, comprised of his hometown Dearborn. As a proud son of immigrant parents, Representative Hammoud has been unwavering in his commitment to Michigan and Dearborn for more than a decade. Representative Hammoud earned his bachelor's in science from the University of Michigan, Dearborn, and his master's in public health from the University of Michigan, Ann Arbor. During his months as a volunteer with the United Nations Relief and Work Agency in Jordan, he led a successful initiative to promote health and wellness among diabetic refugees throughout the Middle East. In 2014, Representative Hammoud was nominated and elected as the youngest board member of the Michigan League of Conservation Voters. Recently, Representative Hammoud received the 2018 National Progressive Leadership Award, given annually to one young elected official nationally for championing progressive policies. Representative Hammoud graduated with a master's in business administration from the University of Michigan's Ross School of Business in the spring of 2019. So now we have young bloods coming into the field, making a difference. So without further ado, Dr. Poland and Representative Hammoud.
Hi, thank you so much for having me here today. I know everything's a little different and strange with a Zoom meeting, so hopefully you'll find that what we're talking about is helpful for you. So what our topic is we're going to talk about coverage for alcohol use disorder for persons in the state of Michigan. So right now in the state of Michigan, are persons who are lives covered under Medicaid insurance do not have access to treatment for an alcohol use disorder that includes seeing a physician and receiving a medication for treating their alcohol use disorder. We can treat their downstream consequences of alcohol use. We can treat the liver dysfunction. We can treat the consequences of using alcohol, but we cannot treat the alcohol use disorder itself and get paid. When we're talking about seeing a physician and receiving a prescription for medication. The prescription is covered, but the office visit is not covered. We do have mechanisms for counseling, for therapy, for acute hospitalizations in terms of detox from alcohol use disorder, but not that longitudinal relationship. And why this is so important is that when we treat substance use disorder, for every $1 spent treating substance use disorder, the healthcare system saves $4. If we translate that $1 spent and we look at community-wide savings, including the healthcare savings, but also savings in terms of criminal justice system, DUIs, lost days of work, we look at for every $1 we spend treating substance use disorder, we actually save $12 in our communities. So this is not only important for the health and welfare of our communities, it's also a cost-effective measure to reduce morbidity and mortality related to substance use disorder. Medications, why do people need medications? Why can't they just go to AA? Why can't they just receive counseling for alcohol use? Well, that works for a lot of people. It doesn't work for everyone. And people may be able to be successful earlier and faster if we give them medications. What the medications do is they essentially take the pleasure reward center in the brain and they stabilize it. They stabilize it so it's not saying we need to get alcohol. And so what then the person can do is then they can function. They can think through what they're doing. They can process their emotions better to be able to better address what they need to do in their life in terms of not only their alcohol use disorder, but also things like their employment, their family relationships, all of those things that kind of make us whole as a community. What we know about addiction when we talk about it with relationship to when we talk about it with relationship to community is that part of what's so important to treatment of addiction is that community development. And in this time, when we are actively asking people to minimize their contact with other people, we are actually creating more isolation. And one of the consequences of isolation that is known in addiction is that isolation increases our risk of addiction. We've seen this happening in the state of Michigan. The opioid overdose deaths are higher than they were even in our worst year of data up to today's date in 2017. And then we are also seeing that in alcohol use. We have seen alcohol sales increase between 30 and 40% each month compared to previous year in our state. So we know that people are consuming more alcohol right now. We know that there are risks to that. There is risky drinking, and risky drinking can lead to a substance use disorder. So we need to come together as a community and treat these folks and offer them medications along with counseling, along with therapy, along with AA. Medications for alcohol use disorder are an important component of that addiction care continuum. I'm not saying they're the only component, but they are an important component. And currently, our citizens don't have access to that. I want to close before turning it over to Representative Hammoud by telling you my story. So I am an addiction medicine doctor. When I was in my training, I had committed to addiction medicine when on December 23rd of 2012, my younger brother died of a self-inflicted fatal gunshot wound, secondary to the depression that was a consequence of his alcohol use disorder. So this disease touches all different types of people, all different socioeconomic statuses, all different genders, races. It doesn't have boundaries. And I advocate for the coverage of this because my brother did have access to AA. He did go to rehab. He did get counseling, but he never got medication. And as his sister, as his family member, I will always wonder if my brother had had access to medications, if he'd had access to those support mechanisms, would he still be alive? All humans deserve and should have the opportunity to make that decision in their life and to have the resources to be able to do so. And that's why I'm here today. That's why I advocate for this. And that's why I'm so excited to turn it over to Representative Hammoud, who's going to be able to tell you guys a little bit about what he and I have been collaborating on, and he's been championing at the state level to increase access to care for persons with an alcohol use disorder. So thank you very much for your time today. And I was thrilled to be able to speak to everyone.
Thank you so much, Dr. Poland, and a sincere thank you for your strong advocacy in Lansing. I truly believe because of your strong partnership, we've been able to make some ground in advancing the legislation that I'll speak of shortly. First and foremost, good morning to all. Thank you so much for having me here. For those whom I haven't met, my name is Abdullah Hammoud, and I have the distinct honor of serving as the state representative for Michigan's 15th district, my hometown, the greatest city in the land, the city of Dearborn. And I want to spend just a few moments discussing our legislation and then maybe just some personal anecdotes from what I've come to realize as we've had these conversations pertaining to alcohol use disorder. In Michigan, as Dr. Poland put it perfectly, currently, if you have an opioid use-related disorder, you can go to your provider and be seen, and that provider can then bill for that service appropriately. However, if you have an alcohol use disorder, that is not the case. Currently, the state does not permit those providers to bill for a patient visit pertaining to alcohol use, and for that provider to then receive the appropriate reimbursement and allow that patient to seek the care they need and develop that longitudinal form, that longitudinal relationship. What we do know, though, from substance use as a whole, nearly 50% of all substance use is alcohol related. So immediately we know that we are possibly halting 50% of those suffering from substance use from reaching out and seeking the care they need, or if they are seeking the care they need, they're being turned away. Based on our conversations with many healthcare providers, we've learned several things. One, we have learned that some providers will turn the patient away, knowing that they're not able to bill appropriately or see the patient for the service. Or two, we've learned that some providers actually bill under a different CPT code. They'll bill under the substance use CPT, under the opioid related CPT code, not to game the system, but to still try to provide the care that this patient needs. And this presents and creates several problems. One of the problems it creates is, one, we're turning people away who are reaching out for help, first and foremost. And I think that is one of the biggest problems that we're seeing. Two, it doesn't allow us to track the treatment of alcohol use disorder appropriately. For those researchers who use claims data to identify what support and what services are being provided, there's actually a hole in the data because of this issue. And third, we don't know the true magnitude of alcohol use disorder because we are not diagnosing and billing and providing the appropriate services for it in the claims data, again, because of this gaping hole in our healthcare system. Now, the bill we're moving forward would address this measure and allow these individuals seeking care to seek care where they are most comfortable. But I do want to say that although this is a very important piece of legislation, I do not want to downplay its importance and all the work that has gone in here by Evie, Dr. Abdullah Hammoud, and by Dr. Poland, who's been our champion up in Lansing. I will say, though, that it's still a reactive measure as we discuss alcohol use disorder. This doesn't prevent any sort of substance use using alcohol. It doesn't prevent that addiction. And so as we begin to expand the conversations on what we can do, I hope we expand the conversation to include prevention and what we can do to change how normalized this has become. I represent the city of Dearborn. And recently, just a year or so ago, we had a family in Dearborn, Fife, the 2 parents and 3 children, who lost their lives to a drunk driver with a history of strong alcohol use. Now, the accident happened outside of our state, but this is a family that lived in our backyard. And I will never forget the sight of 5 coffins laying side by side, from the parents to the youngest child, who was just a few years of age. We do this work because of the people that it impacts. However, what I've realized is whenever we've discussed alcohol use, there's much more pushback. What I've recognized is that culturally, alcohol use is largely ingrained to a degree within our culture, and it's a little more permissible and acceptable than other forms of substance use. I've never encountered pushback when we've advocated for ending the opioid epidemic. I've never encountered pushback when we've advocated to push for smoking cessation or wanting to eliminate the dangerous substance vitamin E acetate, the dangerous chemical in many of the vaping products that were killing children and those who were vaping. Yet when I've approached alcohol use, pushback was always there. When we first introduced legislation, not just this bill, but other forms of legislation to push back and try to provide further support for those suffering from a form of alcohol use disorder or excessive alcohol use, One of the immediate reactions was, well, your name is Abdullah Hammoud. You're Muslim. This must be a ploy to bring Sharia to the state of Michigan as opposed to trying to actually provide help. What do you know about drinking alcohol? I've never received that pushback on any other type of substance use. I don't suffer, thankfully, from any form of substance use disorder. Yet, I receive pushback in discussing alcohol use disorder because I do believe that it's become a little more culturally ingrained. We would all be in shock if we saw a billboard advertising a new form of cigarette or a vaping chemical. Yet it's normalized when it's a new drink that's available, like the form of alcohol. We would be shocked if we saw a commercial on TV that advertised smoking. And at the end, it just said, smoke responsibly. Yet we're okay with seeing it as it pertains to alcohol. We raise taxes year after year on cigarettes in order to push people away from smoking. And the data suggests that if you raise taxes on cigarettes, people are less likely to purchase those cigarettes. Yet we will not touch the tax on any of the alcohol industry, the beer and wine industry, because of the strong lobbying force that's there behind it, even if it's for the best interests of our residents, our families, and our constituents, and Michiganders all across. And so as we expand the tools that we provide providers, our residents, the questions we need to ask ourselves is, how do we prevent? How do we limit? How do we form a more proactive set of tools, one of which has to be, how do we change the conversation around alcohol use? I've used to live on a college campus where we do know there are obviously, the game day tailgating. We do know underage drinking is happening. Yet most of the time, whether it's law enforcement or the administration at a university, they walk on by and just say it's a part of college life. Yet if we replaced that drink in their hand with any other drug or with any other substance, would we have that same reaction? Would we be as permissive to it? And I think the answer is no. And so with that, I'll turn it back over. I'd like to thank you again for allowing me to speak. And again, thank Dr. Poland for a strong partnership. And hopefully we'll see this legislation pass before the end of this year.
Time. Welcome back, and thank you both so much. Representative Hammoud, what is the name and the number of your bill?
We don't have a name for it just yet. We're working on that front. As it pertains to the number, Dr. Poland, I don't have the number of the bill on me. Do you?
House Bill 5408.
There we go. We introduced too many to remember all of them. Thank you.
Because I think when Kate was talking about CMAC, we have an advocacy committee, and we will do everything we can to make sure that we advocate and get that word out to help make that happen.
Thank you.
One question, Dr. Poland, the drug of choice among many of our young people is alcohol. One, because it's easily accessible. During this pandemic, it's right in the cabinet. We've talked to a number of youth in our community, and they said, hey, I just go and get something to drink, whether it's the beer or the wine or whatever's in the house. So what efforts are being done to educate our youth and our communities from your perspective?
So there's various efforts across the state of Michigan. There is required education for the K to 12 age group from the state of Michigan that does include safety around not only opioids, but also alcohol. I was involved in revising some of that 2 years ago. So it is updated and up to date, the information, which is great. But what we know about adolescents is I can yammer at them all I want. I can talk to them all they want. If I am not a trusted adult, it doesn't matter. I don't have an impact. What we need to think about is we need to think about also those individual relationships we have with adolescents in our community. Be there for them, be present, share interest in what they're doing, what they're thinking about, what their dreams and desires are, so that you can have those open, honest conversations with adolescents. And that's not limited to parents, that includes other trusted adults in an adolescent's life.
Absolutely. Representative Hammoud, you said that the state does not allow billing for physicians to provide treatment services. And Dr. Poland, you mentioned that that will give them that access to medication. Could you please explain what the justification for that is, or what justification they use to just not do it?
I will say when we drafted legislation, once we became informed on this hole in the system, and we brought it forward to the department, there was no justification, there was no explanation. There was just, we didn't know this was a situation for many of the conversations that we had. And so the department is actually supportive in concept of the legislation. And what they've told us is that regardless of whether this legislation makes its way to the governor's desk, they plan on issuing an administrative rule change within the department to address this issue and hopefully fix the situation so that providers can begin to bill and patients can be seen.
Do you think that there's light at the end of the tunnel for this?
I certainly hope so, and I do. We've spoken with many individuals. The legislation itself is bipartisan. We've made it out of the Health Policy Committee, and it sits now before the Ways and Means Committee, the next committee within the process of passing this legislation. And we're hopeful. We're hopeful that with Dr. Poland's support, with Evie from MHSA, and with the team that we've put together to advocate for this legislation, that it'll be signed into law before the end of the year.
All right, we're counting on that. Alcoholics Anonymous has seemed to be a good option for people with alcohol use disorder. Why do they need a medical provider? And Dr. Poland, you had started to talk about that. I know you're off our screen, but you're still there. Can we still hear her?
I think so.
Great.
Can you hear
okay.
me?
We can hear you.
Perfect. So sorry, I don't know, my camera just turned off. I apologize.
But can you share, did you hear my question?
So why do people need a medical doctor? Because people who receive one alcohol withdrawal itself can be fatal. So we would like to be able to assess patients before they decrease or eliminate their alcohol use, because even a precipitous decrease in their daily use can result in withdrawal. It doesn't have to be just going to no use at all. So we want to make sure that people have access to medications for alcohol withdrawal, and getting that assessment from a physician before they decrease is often part of that. In addition to that, we also know that medications longitudinally, so long-term medications, getting that prescription for medication that addresses some of the cravings and stabilizes the brain structures, results in fewer returns to pretreatment use. So people don't relapse in the common parlance as much when they have medications. We also know that when we give people medication to treat their alcohol use disorder, that they suffer fewer negative consequences of their alcohol use from both a health and a social perspective.
Awesome. Dr. Poland, I'm going to keep you on point again. The SBIRT, Screening, Brief Intervention, and Referral to Treatment, has really been pushed, and it was originally developed by a physician. And so one of the challenges then is that if they do this SBIRT in their offices, or if we find some way in which they have that information, one of the things that we found in some of the research that we have done is that the physicians are reticent to use it or to assess patients for any type of substance use disorder, one, because of the reimbursement issue, but also because of their not being aware of resources in the community to refer them to. How would you help us to address this issue?
The average practicing physician has between 2 and 10 hours of training throughout their entire medical school career in substance use. We need to increase that. We need to change that. I am fortunate to actually have a grant from the Office of Recovery-Oriented Services with the goal of increasing undergraduate, graduate, and continuing medical education around substance use disorder. We're actively doing assessments at every one of our medical schools, including both the MD and the DO programs in the state of Michigan, to determine where those gaps are and how we can fill them. So we need to train our physicians. We need to train our other healthcare providers as well on how to do screening, brief intervention, and referral to treatment. I think sometimes I tell people we should take the R out, screen, intervene and treat. We don't need to refer to treatment for every person with a substance use disorder. And I think we need to continue to champion that. And I think we need partnership from our treatment system. So many of about 70% of treatment programs across the United States don't offer and don't believe in medications. We shouldn't be using our own personal beliefs to determine what is best for our community. We should be using the evidence, and we should be making sure that all of our programming offers the highest quality treatment for patients in need.
Awesome. Representative Hammoud, one of the ways I know that legislation can be helped to be pushed along is getting the community involved. How do you get your message out to the community so that they can pick up the phone or text or Facebook or whatever we need to do to access you as a representative? And once we do that, what would you do?
So it's a great question. We have a very strong relationship with our community. And this idea for this legislation first came forward from a sit-down conversation we had with some physicians in our community, as well as Dr. Poland. And so, given that it's grassroots in nature, there's been advocacy that's been happening day in and day out on this piece of legislation. What we do is we put out press releases in the local media. We make sure that we're also providing this in the Arabic media. I have a very large Arab American constituency, so we want to make sure that we're meeting constituents where they are. We use our social media, whether it's Facebook or Instagram or Twitter. We host Zoom town halls almost on a weekly basis, or a Zoom coffee hour. And we use that for means to educate the community. Where is this piece of legislation? How can you help advocate? To whom can you reach out? And we do all that together. And it's extremely important. Personally, in my office, if I get 10 emails pertaining to one issue, that immediately rises to the top of my priority list. And so what you want to make sure, though, is if you're reaching out to your legislator, reach out continuously. Don't make it a one-time thing. Attend their Zooms, attend their coffee hours in person. God willing, we go back to that. But continually reach out to develop that relationship with your legislator, so it's not just a one-time effort.
Do you think that if our youth were organized and trained and they do the same thing that you're asking them to do, that it would have an impact, especially when we're seeing, alcohol as that drug of choice for youth?
Overwhelmingly, my answer is yes. And I think it's more than just the youth, but it's also their parents. It's also the aunts and uncles we have in the community, because oftentimes we see the excuses for why maybe your child may suffer from alcohol use disorder, but it's just, no, they don't suffer from any sort of addiction. They just, they drank that one night. And so we want to make sure that we have the parents involved with the children, that they're collectively advocating for it. I think it's also a means of building that personal relationship within the family and making sure there are more people within the community that you identify as partners in this battle.
Dr. Poland, you had talked about in your presentation what I refer to as a return on investment for treatment, that for everyone that provides that treatment, the savings that result from that. How do you, one, communicate that to your other medical professionals, as well as making sure that this information is advocated or communicated as a legislative level, and to the people who then pay or reimburse for these services? It's one thing to have the states say, hey, this is something that we can do, but you've got the insurers who also have to do the same thing. How do you use that information to make a difference?
So the first thing to know is that is coming from published studies, so published journal articles. I share those journal articles. I have copies of them. If GDAC would like copies, I'm happy to share them. And then they were also cited in the Surgeon General's recent report. Well, it's a couple of years old now, but his recent report on treating substance use disorders, particularly opioid use, on a national level. So this is cited, utilized, valued research that I'm sharing with people to make sure that it's clear that this isn't a fantasy. This isn't something that we are making up or based on hopefulness that we're going to have an impact. It is cited data that shows these cost savings.
Great. You also mentioned that the alcohol, in the midst of this pandemic and people sheltering in place, that alcohol sales are up 30 to 40%. How do we communicate to our public? Now, right now we're on Zoom with probably over 100 people that are here, but how do we communicate to the public that are sheltering in place the challenges that this increased sale and consumption of alcohol is going to present?
I think this is another place where we have to come together as a community, and that could be led by the Department of Health and Human Services, but I think lots of grassroots organizations and community-based organizations are truly having a huge impact. If we can convince some of our news channels to do public service announcements, if we can put it on the radio, if we can get it out there that there are resources available in each of these communities to help with people who are feeling isolated, alone, scared, any of those consequences that happen when we all go into isolation, regardless of COVID, and then add on all of the COVID anxieties as well. I think that if we can make that well known and make that accessible for our communities, then we will be able to minimize those risks, and just raising awareness that people are drinking more, and making sure that people know what safe drinking limits are.
Dr. Hammoud, Representative Hammoud, same question for you.
You gave me a promotion.
I did. You well deserve it. Take it.
Thank you. I'll say this. I think, at the state level, it's also important to understand we're dealing with legislators who might be appropriating the money for how these types of outreach programs are designed. The majority of legislators don't have a background in health policy or healthcare industry. And so what it's going to take is for many of us on this call to educate the legislators and work to bring them up to speed on the importance of these issues. Secondly, I think the conversations have to stem from home and from within our community at the places that people trust. If it's a place of worship where the preacher standing, you're still giving Zoom, we're still giving Zoom seminars. We still want to encourage the preacher, the imam, the rabbi, the priest to talk to these issues. If there are social media influencers that we know that our youth follow, we want to connect with them and have them speak to the issue. It takes just a few minutes. I think those avenues, our children, our family members are going to be much more receptive to, as opposed to another commercial from the Department of Health and Human Services. And now in the battle of COVID, we already know we're having a tough time getting people to wear a mask, for example. And we're spending millions of dollars through various forms of media trying to educate the importance of masks. Yet it's still hotly debated. So let's go through forms that people trust currently without needing to build those new ways of connecting and utilize what we have. We each have a role to play and have a responsibility within our own communities. And I think if we start there, we can make a difference.
Awesome. So we're connecting to the people that we serve. You heard here first the call to action that we are empowered to do something. We are empowered to use our voices to impact legislation. And so we wish you luck. Keep us posted. You said within the year it's going to be passed.
God willing.
I give you 9 months. Let's make it happen, sir. All right. Thank you again, Dr. Poland, Representative Hammoud. Thank you so much for sharing with us this morning. And stay well and stay safe.
Thank you. God bless.
Thank you.